Hi, everyone. I hope you guys are doing fabulous today. Thank you for joining me. Very excited to be here. I actually want to thank Tracy at It Takes a Village Walking Club. If you guys haven't checked out that Facebook page yet, you definitely want to. A great walking club. She actually got me on all these pop-up talks this month, and I think I became a little bit addicted. So I'm very excited to be here today. So I wanted to talk to you about your dog. Basically, it is the season for itching, and I know this can be a little challenging for pets as well as their owners, especially when you hear your pet scratching constantly. It is hard, and I think the number one complaint that I've heard as a veterinarian is that there is some concerns about sleeping. The dog's not sleeping, and I'm not sleeping. So I wanted to touch upon a little bit about itching today and talk to you about a new supplement that is out there. So let me get the presentation going. Before I begin, I know you guys are watching this on Facebook, and it is very easy to go ahead and just comment at the bottom of the Facebook page. However, because I am using something called StreamYard, so you can actually see this presentation while I speak, I won't be able to see your comments unless you go ahead and give StreamYard permission. So if you look at the bottom there, if you go StreamYard /facebook.com, you can actually give StreamYard permission for me to see your comments. So please do that because I definitely want to hear what you have to say. All right, so let's begin on our presentation. So I wanted to talk about the most common reasons for itching. I did post something on my Facebook page, and if you guys haven't liked it, you definitely want to because I had lots of information out there this month. Some other videos, pop-up videos with It Takes a Village Walking Club. And I also had some raffle entries that I was giving away. So at the end of the month, I am basically picking out names for a raffle prize or multiple raffle prizes. This is our 4th year anniversary, so I wanted to do that since we didn't get a chance to invite you guys all over the clinic this month or this year. So there's opportunity for you to do that. And one of the raffle prizes or raffle questions I had was, what's the most common reason for itching? And a lot of people don't know this, but fleas are actually number one. And it's something we don't like to think about because we all have clean homes and we don't understand how our dog could get fleas. And a lot of times we don't see the flea. However, it just takes one flea bite to cause a dog to start itching. And if they're allergic to it, they will flare up and they'll be constantly itching. So if your animal does have issues with itching, it's really important to always have flea prevention on them. And if you have multiple animals in the house, including indoor cats, highly recommend it. Your dog can actually bring live fleas in before they die. They get on your cat, and you never see them on the cat most of the time because the cats groom, and when they groom, they lick the flea, they swallow it, you don't see the flea. And unless your cat's allergic to it, you will never know there's a flea on them. But when the flea bites, then they lay eggs, and those eggs can basically hatch in your house and then get on your dog that might be allergic, and then the allergen, it appears, never gets away. So you definitely want to continue with flea prevention. I know there are some questions about different flea preventions. Feel free to touch base with your veterinarian about it. A lot of them have multiple different ones to choose from. If you're concerned about flea prevention getting into the bloodstreams, I know a lot of you are. Frontline Plus does not get into the bloodstream, but it's great for fleas and ticks. The one thing for you to be aware of, though, is that fleas and ticks know when the frontline's going to be done. So about 3 to 4 weeks later, the fleas know it and the ticks know it, and you start seeing them. So sometimes when it's really a heavy burden out there, you might want to apply every 3 weeks versus every 4. So something to think about. Louise Daigle is commenting. Hi, Louise. Thanks for commenting. Let's see. Hey, Dr. Wilson, Manzo is ready to learn how to be less itchy. Well, I hope this talk helps you today. And Manzo, I hope you're excited to be watching this presentation. And she also mentions that fleas are so gross, and that is correct. And I think this picture is a little gross too, but I thought it was a good, funny video, funny picture to have on the screen today. All right, so let's go to the second most common reason for itching, and that is something called atopy. So that's seasonal allergies. A lot of times people, when they see their dog itching a lot, they're concerned that there is a food allergy. It can be a food allergy, but a lot of times it's actually seasonal allergies. And as I mentioned before, if your dog has allergies in general, they can have a flare up to one flea bite. And if they have one flare up to one flea bite, potentially they have other allergies as well, like food allergies. So usually it's a combination, and a lot of times it's one's more severe than the other. So that's something for you to be aware of. Food allergies are really challenging because it is really, really trying for the owner, the veterinarian, to find a food that will actually work. Over-the-counter foods, I'm going to talk a little bit about that right now. Over-the-counter foods they do not pay close attention to all the ingredients that go in there. So the ingredients on the list on the back of the bag, sometimes it's contamination. So if your dog has a true food allergy, even a little bit of a certain protein could cause him to flare up. Prescription foods are different, so that's why a lot of veterinarians will recommend a prescription food if they're really concerned about food allergies, because when companies actually formulate the food and make the food, they actually clean up the whole piping system and the whole I'm trying to think of the word machine, the whole machine before they actually produce the prescription diet. So a lot of companies, and that's a really great question to ask too when it comes to prescription diets, but most of them, they'll actually clean the system out the night before, and then the first thing they make is that prescription diet food. We do have a comment from Bonnie, again agreeing that fleas are gross, especially if they get into the house, and that is correct. It is hard to get rid of. So another reason to treat all your animals with flea prevention, even like the ones that don't go outdoors. That way you don't have to ever worry about that. If fleas cannot continue to reproduce, if they do not continue to find a place they can bite, they won't continue to reproduce. And then you won't have that huge infestation in your house. So a lot of parasitologists and specialists out there actually say you don't need to worry about bombing your house necessarily or spraying things, as long as you have everyone on board and treated in the house. And it takes about 3 to 5 months for that flea cycle to go away. So they actually can, this is again gross. So sorry for all you guys listening out there. But what can happen is they lay the eggs, and then there's different certain stages. And one of the stages actually is in a little cocoon, and nothing can penetrate that cocoon to kill it. And they can stay in that cocoon for about 3 to 5 months. So you don't want to just treat your animals for 1 to 2 months. You want to continue for at least 5 months to get rid of that flea cycle. And I recommend to continue it all the time, just because you do not want that to come back. So I'm really glad you brought that up about the house, because I don't, and I know you guys don't like to bomb your house, and you don't necessarily have to do that, unless of course there's a huge flea infestation and people are getting bitten. But most of the time that's not the case. And like I said, if they can't feed on the animals, then they cannot find a place to reproduce. They won't reproduce, and then your cycle's gone. So that's the best way to do it. So with seasonal allergies, we sometimes notice different types of the year where they have flare-ups. And one thing I do during my nutrition and supplement consultations, I always take a look at the medical records. And if there is an issue with allergies, I will go ahead and literally write down all the dates that I see where there is an ear issue or a paw issue. Because when there's a seasonal allergies, it can affect any area of the skin. So you're looking at ears, you're looking at paws, you're looking at the belly, you're looking around the mouth. And if I see any history of that, I start writing down those dates. And a lot of times I see a pattern. They can have like I said, potentially flare-ups from other things later on in the year, but usually the most flare-ups are during a certain types of season. And then we know potentially when they're mostly affected by the allergy. So how does allergies happen, and why is your animal going outside and having seasonal issues during certain types of seasons? The skin is a natural barrier against different types of parasites, allergens. Allergens are basically anything in the air, for example, that can irritate our skin and cause allergic reaction. Same thing with animals. And when our skin or our pet skin is not healthy, they can penetrate the skin more and cause a reaction. And as you see here, this little red, call it like a little red sun, shows, it actually says allergens above it, shows how it penetrates the skin and goes underneath. And then you see a little reaction there. That's actually inflammation that's happening, an allergic reaction. And what we want to do is kind of calm that down. So we want to build that skin barrier up to its normal regular health again. Now, sometimes we do still have to use traditional medications because you're having a reaction and you got to calm that down. That's really important. But then you want to get to the source of the issue, which is that skin barrier. And that's what I'm going to talk a little bit about today. And that's why I wanted to talk to you about that supplement that I've been hinting at. Oh, goodness, I think it's been all month now. But before we get there, I do want to talk about some things that are out there medication-wise for itching. A lot of you have had pets that have been on different types of medications. Some of them have been on antihistamines like Benadryl or hydroxyzine, and that can definitely calm down the reaction. A lot of dermatologists think it helps a little bit, but it's not really helping as much as we want. So if it's a really intense allergy, a lot of times we do have to use something like steroids or something like Apoquel. Apoquel, I think, has been a dermatologist's dream. And the reason I say that is steroids, like prednisone, I think a lot of you might be familiar with that, can cause increased drinking, increased urination, and even for a short period of time, it can be really a hassle if a dog's really sensitive to it because you have to bring them outside constantly. It also increases their appetite, which can be hard, especially if your dog's already prone to being overweight. Long term, it's not really that safe. We do use it sometimes to control certain diseases, but if there was something out there besides steroids that could help out with the itch, we want to use it. And that's where Apoquel came in. Apoquel does not have the same side effects long term as steroids. And in fact, the only side effect I have actually seen an animal have with Apoquel is nausea. And usually it's what we call self-limiting. So usually within 5 to 7 days after being on the medication, they actually feel better. What I would do if I had a patient that might have a little bit of upset stomach with it, I might cut back the dose a little bit and slowly build it back up to a level where we want it. Now, some animals are more sensitive. My dog, Jenkins, I always talk about him. I love him to pieces, probably because he's like the veterinarian's guinea pig, because everything that happens to a dog happens to Jenkins, unfortunately. And I love him to pieces. And he is a dog that when he gets an upset stomach, he'll actually go out and eat grass like most dogs do. But not only that, he'll come inside and he has eaten pieces of our curtain before to make himself vomit. So when my dog is on Apoquel for seasonal allergies, and I tried this with Jenkins, and my other dog did fine with it, but Jenkins decided to start eating the tablecloth while I was having dinner. And I thought, it's just not really worth it. We can try something else, and there are definitely a lot of supplements out there and other things we can try, and including diet, which I should have had diet in the slide. There are some things out there for dogs. Royal Canin makes a great skin support diet for allergies, and that's what generally I would have him on, because Apoquel doesn't work as well with my dog. So if you have a dog like me, which I will tell you after 15 years of veterinary medicine and working in clinics, I have never seen a dog like Jenkins who would do something like that. So most likely you don't. And if the nausea isn't bad and you can cut back the dose a little bit to make him a little more comfortable and then go up to the optimal level for the medication, it is a good medication to have. And you can stop it suddenly, and you can use it long term. Now, Cytopoint is the last medication I have written here, and I really like Cytopoint a lot. Cytopoint actually is a natural antibody. They produced an antibody that will attack this substance here called IL. Interleukin is what that stands for, causes itching. And this antibody, when it's injected into the dog, will actually attack that and stop that process from happening. So it stops that pathway so the dog doesn't itch. It's been out for a while. I like it because it's more of a natural type of medication. I almost think of it as a supplement almost, even though it is a medication. And the injection lasts about 2 to 3 months. So a lot of times the seasonal allergies, if the dog is really responsive to it and it lasts that long, they don't have to get another injection, maybe just at least once before their allergy season is over. So that's a good thing. And if you're like most people, when it comes to medications, it's really hard to give regularly. And this way, your veterinarian just gives an injection, and you don't even have to worry about it. So we have a comment up here. So let me grab that comment here. Thank you, Bonnie, for your feedback. So Bonnie writes, Apoquel worked for Stella for the first year, then was not effective the next year. And that's interesting. I mean, some dogs, they will be responsive to Apoquel. I find most dogs are. And it's interesting that 1 year it worked well, but the other year it didn't. I'm wondering if potentially it might have been the worst allergy season. It just wasn't enough to control the symptoms. Oh, and I was just going to ask Bonnie if she tried the Cytopoint injection, and it looks like she actually did. She actually just commented before I even had a chance to say anything, and she said she didn't feel like it helped, and that's too bad because at Cytopoint generally I find it does help more dogs than not. But Bonnie, I'm really glad you're watching this talk because we're going to talk about something next that might be helpful, and it's something called Dermaquin. And Dermaquin is a supplement that there are some research that if you use it with regular traditional medications, like if you use it together, like with Apoquel, for example, or Cytopoint, it might make it more effective. And then potentially you can actually get off the other medications and they'll still be just as effective while they're on the medication. So that is definitely something to talk to your veterinarian about. It is a veterinarian product, so you cannot get it online. It is fairly new too. I think I learned about it, I believe it was January of this year. And so it's a fairly new supplement, but it's definitely one, Bonnie, that you might want to try out. So let's talk a little bit more about it. So as you see in this slide, and I'm going to make this slide a little bit bigger for you, everyone, so they can see it here. There we go. So as you see in this slide, we talk about Dermaquin as being a best defense for a hardy skin barrier. So as we talked about, the skin is really important to stop these allergens from getting into the skin and causing irritation. And Dermaquin helps build up that natural skin layer. It includes multiple different types of ingredients. One is called hardy kiwi, and the other one is called beta-glucans. And then there's a safflower oil, which you see there, and some omega-3 fatty acids. Now, the omega-3s isn't really high enough to be therapeutic for an animal, but the other substances are. So what I tell people is when they use Dermaquin, if there's skin issues, definitely get on the good omega-3 fatty acids too. Well-Actin Advanced is a really good, and even actually you could probably just do Well-Actin too. Well-Actin is really good for skin issues, and it has a really good source of omega-3s. So that's something that I would use with the Dermaquin. So let's talk a little bit more about those ingredients. And this is just another slide just showing how the different benefits to these ingredients, like the other one. So what is hardy kiwi? And I don't know what this picture was, but that looked delicious. So I had to put it up there. Hardy kiwi is not your traditional kiwi fruit, but it is something that's similar. And it's used traditionally in East Asia to help out with allergens. And there is some research showing how effective it is. This actually you can find right on their Dermaquin website. And definitely something to think about checking out. So this study shows, if you look in the chart, the blue is the placebo group, and then the green is the group of dogs that had hardy kiwi in their treatment plan. And as you see at the beginning, when they looked at it, they call it a skin assessment score. They actually look at how itchy an animal is, and they look at other factors of the skin to show that there's some irritation of the skin. You can see they're both equal, but as the days went on, especially when you get to day 28, you can see that the amount of dogs, or the skin assessment score, I should say, was a lot lower than the placebo group. And when you actually, like I mentioned, if you take them off that medication and you keep them on the Hardy Kiwi, it actually helps keep it at that level. So that's usually what I recommend for owners that come see me for a consult, is we talk about the medications they might be on for allergies. And then we go ahead and we start them on Dermaquin, and we see how they do. It takes about, I would say, a month before I tell them to start cutting back a little bit on their medication. Sometimes we can't cut back completely. And what I've noticed in a lot of patients is we're able to do that and actually cut back completely. But if we can't, at least we get a lower dose of the medication. And when it comes, I don't mind medication. I still do traditional medicine, but it's nice when we can try to have something else to use and maybe use a combination. And when it comes to the Hardy Kiwi and Dermaquin, there's not a lot of side effects, and it's building up the skin barrier. So it's actually looking at the cause of the issue. And that's what I like to do. I like to not just treat the symptoms, but look at the cause. So if we can do that, that'd be great. Now, I don't know if any of you have been to my pop-up talks that I've done with the walking club, but we did talk a little bit about beta-glucans, excuse me. And there's a study here, as you can see, and it shows that 63%, the itch actually decreased by 63% with beta-glucans. So beta-glucans is good for the immune system, but also helps out with itching. So before we go, I'm going to take a look at the comments here, because I do want to, we got a lot of comments, and I definitely want to put your names in a raffle to win a bag of this. So Bonnie, you mentioned that you might want to talk to your vet about Cytopoint. Well, you might be lucky and win something here. So I am going to go ahead and just leave the screen up for a second, and I am going to enter your names in a little raffle drawing. So bear with me here, and feel free, if you have any questions right now, please feel free to leave comments, because I definitely want to answer any of your questions that you might have about this supplement. I'm keeping an eye there on your comments here. All right. So we're going to go ahead. I'm actually using something called a wheel of names. Let's see if I can get this up for you. I am not as technically savvy as a lot of people out there. I'm learning as I go here, so bear with me. But let's see if we can share that screen. All right. So we're going to go ahead and we're going to move this over here. There you go. I want you guys to see everything here as I go ahead and try doing the wheel of frame here. There we go. So who is going to win a bag of Dermaquin today? Stacy. So Stacy, you get a bag. Thank you guys all for your comments today. I really appreciate it. And Stacy, if you wouldn't mind to go ahead and just private message me in Facebook, that'd be great. And I'll get in touch with you and we'll decide what size bag you need. All right, we do have a few more comments here. So Louise Diego wrote, is a supplement available over the counter, or is it just from veterinarians? Right now, it is just for veterinarians. Nutramax has decided, I think, with a lot of their products to only give it really to veterinarians to sell. They want to make sure that whoever's selling it is properly keeping it in a proper location, proper environment, temperature, things like that. So right now, you can get it from your veterinarian. You can definitely touch base with me too if you do want to learn more about the supplement, other types of things to help out with your pet for skin. I do have some of the products at the clinic, so if you do want some from me, you can definitely let me know, and I will definitely get that available for you. And Jessica, hi Jessica. What age would you start it? You know, I don't think you need to start right away. I think I know you have a puppy out there. I don't think you necessarily have to have this animal on this supplement unless you start seeing some issues. I mean, it will help just preventatively. So if you wanted to start at a young age, you definitely could, but you don't have to. What I might do if you had a puppy, a young dog, I might start with more of the immune supplement or a probiotic. There are different ones out there. There is one called Imiquin, and I will type that up for you. That is an immune supplement. And then there's a great probiotic too that will help out as well for immune system for animals. So you can go ahead and definitely look into those supplements, but I don't think you necessarily have to. If you wanted to do a lot of preventives, you can definitely do that. But like I said, it's not something I would do unless you start seeing some issues. I actually started my animals on it primarily because, as I mentioned, they have allergies. And I will tell you, they're actually doing really well. I had mentioned a diet earlier today called Skin Support from Merle Canin. That works phenomenally. I have both my dogs have allergies. One of them is a pit bull mix, and they're more prone to skin issues. And Hazel, the pit bull mix, tends to have inflammation on their paws regularly, on the belly regularly, around their mouth regularly. And the skin support always worked well. And generally for her, I would start it when I noticed her flaring up. So usually it's about 5 to 6 months out of the year. But I did start her on Apoquel earlier in the year before I had the skin support. And then I heard about Dermaquin. So I actually held off on buying the skin support and did the Dermaquin. She is completely off the Apoquel. She's only on the Dermaquin. Her skin smells great. If any of you have pit bulls, a lot of times their skin just doesn't smell the way they should, and they lay in the blanket and you gotta wash the blanket. I don't have to do that with her anymore. And she's on it on a maintenance dose. She's doing fabulous. She has her paws look great. Her mouth looks great. She smells wonderful. So it's working really well. And Jenkins is on it too. Jenkins, I think, might need to be on two different things at once just to kind of calm things down. But it's definitely gone down about 75% of the itching right now, which is really good. Lucky for my dogs or my little guinea pigs when new things that come out. If you guys are my clients, which it seems like looking at the comments here, a lot of you are, you know that I don't usually recommend something unless I have personal experience with it or if I've heard from multiple people that it works. So I always look at the research. I always keep an eye on things when things first come out and I see what happens. And if I do have an animal that may benefit from it, I try it out and I see how it goes. And definitely saw a difference with the Dermacrim. So Stacey, and you're right, I get to see you on Monday. Thank you for I see the last name now. So wonderful. So you got your free bag, which is really good. And you have mentioned ears and paws being itchy. Is dragging the butt also a sign of allergies, even if the anal glands are fine? Absolutely. And that's a great question. I'm glad you brought that up. I definitely see dogs with allergies, with anal gland issues, even veterinary career, working in the veterinary clinic. I'd see a lot of anal glands that were empty and the dog was very itchy back there. So some things you want to do when you see that, you always want to drop off a fecal sample to your veterinarian. There are certain parasites that can cause itchiness back there. One of them is tapeworms, and you won't always see the tapeworms. In fact, even a fecal sample, you might not see the tapeworm. So it might be a good idea if it's a constant thing to actually just talk to your veterinarian about just prescribing something for tapeworms just in case, especially since you don't always see it. But definitely, the other thing that I always think about too is the allergies. And Bonnie there, thanks to you for your question. That was a really great question. I had a lot of fun today. Thank you guys for joining me. I'll wait a few more minutes a few more seconds, I should say, or minutes, depending on how much the comments keep on going here. But I really appreciate you guys reaching out and being interactive. I love chatting with everyone. It's been really hard during the COVID situation, not seeing everyone regularly, and I love doing these Facebook Lives, but I definitely wanted to be interactive. So I really appreciate all your comments. If you guys have any questions, you can definitely reach out to me. You can check out my Facebook page. You can check out my website, acupetvet.net. But feel free to email too if you're interested in nutrition supplement consultation. I do that depending on what's going on. If I feel like the animal's had a recent exam and had a good workup done, I don't need necessarily see the pet, but just look through the medical records and maybe potentially see the pet like on a Zoom call. We can definitely do that, or we can also plan it so you can come in and I can take a look at the skin myself and give you some ideas about nutrition and supplements for things like this. Thank you guys for everything, and this was a lot of fun. I appreciate it. And I'll see you guys next time on Facebook Live. Take care. Bye.